And earlier today, the president compared Operation Warp Speed, the vaccine initiative, to the Manhattan Project and promised rapid development.
We're looking to, when I say quickly, we're looking to get it by the end of the year if we can. Maybe before. We're doing tremendously well.
Now, to fact-check the president's remarks, NBCNews.com political reporter Jane Timm joins me now. Jane, you spoke with several vaccine experts. How realistic is this goal?
You know, I talked with some of the best vaccine creators out there, some of the people who created things like the rubella vaccine that all of us have gotten to go to school. And they said 12 to 18 months is optimistic. It depends on the science, but it's doable in this all hands on deck environment. I didn't hear anybody say by the end of the year was likely or probable, as the president says.
But there's a chance?
You know, they said in this unprecedented environment, there's always a chance. But they said, you know, it really depends on the science. I mean, of course, we have more than 100 vaccines in efforts in preclinical trials and 8 in clinical trials. But that doesn't mean that they're going to work. They said, you know, you can do all the science, you can get it right. But when it comes to actually injecting it into people's arms, it may not work. And it usually takes a long time to get these right. But we are speeding through these processes, as Dr. Torres told us.
Yeah, the president also vowed the vaccine would be produced at a massive scale. Let's play a little bit of that.
Operation Warp Speed is also making the necessary preparations to distribute these life-saving treatments at scale. So we're talking about massive numbers so that millions of Americans will quickly have access to them.
So let's say a vaccine is developed. What's the process for getting it available to everyone?
You know, this is actually one of the most complex parts of this, is that you can find a vaccine that works in a lab, but how you get it mass produced very quickly and also get it transported all over the country. Keeping a vaccine, a biologic, stable from plane to tarmac to doctor's office, it's actually a huge effort. And that's part of the problem. They have to figure out and vet all of these things. Now, the production of it does take months, according to vaccine creators. And they said, you know, you might have a sense of a vaccine that works by the end of the year, but getting it mass produced and into people's arms, I heard middle of next year would be a pretty great scenario.
And we've also heard from experts saying that there might be negative consequences of fast-tracking a vaccine. Can you tell us about some of the concerns, some of the possible downsides to getting a vaccine developed so quickly?
This is what a lot of the vaccine makers I talked to who said, you know, there was one guy who did a rotavirus vaccine that I spoke with, Dr. Abbott. It took him 26 years. And he said, you know, when you get to the finish line of creating a vaccine, you know, you feel relief, you get FDA approval. He got licensure in this case. And but there's still some worry. They said you don't know everything when you finish a scientific discovery like this. And a lot of doctors were saying, you know, we won't know everything until, say, 3 million doses are out the door. You know, these clinical trials take tens of thousands of people, and they give you a really good sense of safety. And all the doctors I spoke to said, you know, we're going to have a sense of safety, but we won't know for sure about rare side effects. And we're likely not going to disprove rare side effects until we get these vaccines pushed out quickly. And they said, you know, licensure isn't going to happen with the first round of these vaccines. You're going to get emergency use approval, which means they haven't gone through the full multi-year studies. But with efficacy studies, they show some promise, and they see a greater benefit to getting them out the door and into people's arms and saving lives, hopefully.
So vaccines are one thing. Testing is a whole other. One of the tests that we've heard the most about is this Abbott test. The FDA now seems to be investigating the accuracy of the Abbott test. That's the test for COVID-19 that the president and his staff have used. An NYU study showed that it could miss something around 48% of infections. The president seems to have the full confidence in that test. I think we have a piece of tape on that. Let's take a listen.
No, Abbott's it's a great test. It's a very quick test, and it can always be very rapidly double-checked. If you're testing positive or negative, it can always be double-checked. But it's a very good test, very portable, very quick.
So what specifically has the FDA found so far with the Abbott test?
You know, after we saw that study out of NYU, the FDA started investigating this study, saying we're going to double-check and take a look at this. And they said that if you have negative tests, that are not they don't make sense with the symptoms of a patient, you should double check them. But essentially, they're expressing some caution about the accuracy of the test here. And there is some worries. This is why reporters ask about this when you have a president who uses these tests for people who interact with him. You know, there's obviously great concern about a president getting this very scary virus. So when you have dozens and dozens of people who use this test to be allowed to interact with the president, there is some concern. And I mean, these tests show pretty high false negative rates that give people false confidence. And that's something that experts say is really dangerous right now. Any kind of false confidence, false idea that you're not going to spread it, when in fact there are asymptomatic carriers with this coronavirus.
Jane, what a rapid fire fact check. Thank you so very much.
Thanks.
Hey, NBC News viewers, thanks for checking out our YouTube channel. Subscribe by clicking on that button down here and click on any of the videos over here to watch the latest interviews, show highlights, and digital exclusives. Thanks for watching.